Excellent. Just going to move myself over here. Okay. So my name is Kristen Bradley. As you all know, I'm just going to move on from there. We already got the intro. So today we're going to talk about blood sugar spikes and how to avoid them. Yeah, it sounds like a common topic, but really there's a lot more we can do than the traditional guidelines you may have heard of. So having said that, let's talk about first why it's important to avoid blood sugar spikes. There are many reasons, both short-term and long-term. So let's talk about short-term first, which, having a blood sugar elevation can impact your mood. It can cause fatigue, cognitive impairment, right? It can make you hungry, extra hungry, impair your vision, and even cause increased urination. Long-term, though, we're talking about inflammation. So what do I mean by that? Well, if you look here at this picture, you can see 3 different examples of your blood vessel. And the third example, which is labeled hyperglycemia, you can see those white dots. That's glucose in your bloodstream. And that glucose, when it becomes elevated, your blood becomes thick and sticky and it rubs against the artery wall and it causes all types of disease because of that inflammation. We're talking about insulin resistance, right? Your body's inability to process glucose properly, leading to prediabetes and then type 2 diabetes. We've got heart disease. Think about all of the inflammation in your arteries, the rips and tears that are caused that need to be repaired with plaque or cholesterol. That's the relation to heart disease. And then we have kidney disease, neurological diseases like Alzheimer's, which is also known as type 3 diabetes, and retinopathy. So that's where we talk about your impaired vision and how those blood vessels around your eyes are impaired. So these are things to think about as you're thinking about your glucose levels getting higher. That thick blood is really that thick glucose, rather sticky glucose in your blood is really inflammatory. Okay. So now we're going to shift gears a little bit. We are going to jump right into food because I know that's probably why most of you are here. So I'm going to start with fiber. Fiber is, I'm sure you've heard of fiber. Yes, fiber helps. But fiber is really key in my presentation today because fiber is going to reduce glucose spikes of any food that comes after it, okay? So think about this in your mind. Fiber actually attaches itself to your intestinal walls, and it forms this viscous protective mesh that stays in place for a few hours. So the food that's coming in, it basically slows and reduces the absorption of any glucose coming in during that meal because of that fiber mesh. Therefore, that fiber mesh is like a wall that the glucose has to push through to get into your bloodstream. So it takes longer for blood sugars to convert to glucose, get into your bloodstream, and the spike ends up being much lower, okay? So fibrous foods considered carbohydrates would be vegetables. And in here, we've got 2 types of vegetables, which we'll talk about more in a minute. You've got non-starchy vegetables and then some starchy vegetables. You've got fruit and whole grains, okay? So let's shift into the non-starchy vegetables for a minute because I think I want to just differentiate. So with vegetables, the non-starchy vegetables are the types of vegetables that you can eat in unlimited amounts. You don't have to worry about them raising your blood sugars unless you're juicing with like a carrot or a beet, okay? Other than that, we have starchy vegetables, and we want starchy vegetables like a sweet potato versus a white potato, okay? We've got root vegetables, and then there are beets, there's acorn squash, butternut, so those are other good high fiber starchy vegetables. However, we have to be careful because those carbohydrates can elevate your blood sugars too high. So we want to think about them in moderation. Now we've got the category of carbohydrates that I know you all know about. Whoops, sorry, I didn't mean to do that. Okay, so we've got refined carbohydrates. So refined carbohydrates, you all know about these: white bread, white pasta, okay? These are foods we want to avoid for the most part. Doesn't mean you're never going to have them again in your life. We can't live in a box, but it's important to just differentiate for today because we will be talking about refined carbohydrates moving forward and give you some examples as to how to eat them and when to eat them. Protein. Protein is a big key player. It's important for us to just mention protein because it will come up in the rest of our program today. So protein comes from animal, dairy, eggs, meat, poultry, fish. Protein comes from non-animal, nuts and seeds, beans and legumes, non-dairy cheese. Why is why is protein important? Because protein also helps to stabilize your blood sugars. Protein offers satiety as well. So you're not hungry 5 minutes later after eating a meal without protein. Protein coats the carbohydrate, which helps to slow the breakdown of the carbohydrate into glucose. So protein, fiber, they all have the same concept where they're helping the carbohydrate slow the breakdown of that carbohydrate. So combining carbohydrates and protein is key to maintain stable blood sugars. Okay, and stay tuned for my demo later. Now, the F word. You've all heard of the F word, right? And fat. So that should be a part of your diet. You know, back in the 80s, fat was bad. Oh my goodness. It was like fat free this, fat free this. Well, we need fat. That is such a good source of fuel for our body, for our brain. It also does help to slow down the absorption of carbohydrates when combined, like fat and carbohydrate combined will offer satiety, reduce inflammation, and fat should not be excluded from your diet unless medically advised. And you can see good examples of fat here: wild-caught salmon, avocado, extra virgin olive oil, ground flaxseed. And like I said, it should not be excluded from your diet. I am just going to, whoops, what did I do there? Sorry, not sure what I did. Maybe you didn't see that. Danielle, am I okay here?
You're good.
Okay, I thought I changed the view of I just wanted to put out my pointer. Okay, there's my pointer. Just trying to figure out how to make my screen bigger again. You know what
It's fine on our side. What
is
are
it
you seeing?
really? Oh, I see. It set me up so I can see the next slide. Um, didn't need to do that. Well, that's okay. Let's see how this goes. Now, so I just talked about carbohydrates, fat, and protein. Food combining. This is key. Okay, this is what we're going to be focusing on now. And I'm now going to introduce you to Jessie. I'm not going to try to pronounce her last name, but we're going to call her the glucose goddess. Some of you may have heard of her. I'm going to share some amazing examples of some non-traditional ways to lower your blood sugars. Sorry, not lower, but reduce the spike, should I say. So Jessie is a French biochemist. She developed type 2 diabetes, and on her journey, she developed all these tips through her science brain. Like, she's a scientist, so she knew scientifically there should be a way to do this. So after doing this, she actually was questioned by a lot of colleagues. How'd you do that? You know, tell us about it. And so she became pretty popular in her world, and she wrote a book, and she's got several books. She's all over the internet. I'll talk about that in a minute. But we are going to cover her blood sugar hacks, most of them today. So let me move on here. Now, I'm just going to make sure I have my notes here. So one thing I'm going to mention before I even get into her hacks is that she doesn't promote her recommendations or her guidelines, her hacks as a weight loss program. She is trying to help you, what I call flatten the curve, which we'll talk about more. She's just trying to help you avoid those blood sugar spikes. Now, having said that, you can certainly take her hacks, and if weight loss is a goal, you can apply that and you will see weight loss. I do it with patients all the time, but you'll see why I said that when we get to some of the examples moving forward. Okay, so moving on. Let's start with savory versus sweet breakfast. Oh, you know what? Well, yeah, we'll move forward here. So savory versus sweet breakfast. The first thing I want to show you here with my pointer is there's two graphs here. There's one on the top, one on the bottom, but we'll just look at the one on the top. If you look at your blood sugars, this is your blood sugars as they elevate. You see my pointer up and then they go down, right? That's because there's a spike. This person ate a meal that caused a spike. So you can see here that, you can see here that the spike line is where we don't want the blood sugars to go above, because that means we're causing inflammation and we're causing that thick, sticky glucose in our arteries, right? So this is your baseline. You want blood sugars much closer to your baseline. Having said that, let's talk about a savory versus sweet breakfast and what's happening. So the top example is, well, actually, we're going to start with the bottom picture. So the bottom picture is a picture of somebody who ate a breakfast that kept their blood sugar stable, kept their flat, their curve very flat, right? So you see you got the balance with protein and fat and fiber. The fiber is coming from the sourdough bread, the avocado, and you can see that blood sugars were stable for quite a long time, keeping you full and satiated. However, the top example, blood sugars spiked. And I'm going to suspect that that person who ate that meal, because there was no protein in that meal, that person was probably hungry an hour later, right? So there's the big difference there. Let's talk about veggie starters. This is another one of her favorite hacks. So she really, really emphasizes eating fiber or vegetables, non-starchy vegetables at the beginning of a meal. So here you can see someone had some vegetable lasagna and blood sugar spiked, then they dropped, then they went up again, and they stayed up real high. The individual who consumed a salad, greens, before this lasagna, look at the difference in those blood sugars. That's amazing. No spike. So what she says here, I thought was very interesting in this quote. She says, I'm always shocked and thankful at how well this hack works. She said, and remember, Veggie Starter doesn't erase the food you eat after. It doesn't mean that if you make an unhealthy choice, you're going to have overall health benefits. So I just wanted to point that out. Let's look at another Veggie Starter example. So someone ate some sushi, but they had edamame first. Edamame is full of protein and fiber. So clearly you see a major difference in those blood sugar reactions. So you see a spike down below with just the sushi. And what's even more important, if you look down here, look at how blood sugars dropped. And what does that cause? That causes a craving, right? So that fiber can be so critical, and you can apply this anyway. Okay, now we're going to talk about naked carbs. Excuse me, I'm just going to. Okay, naked carbs, right? My goodness, these funny phrases. So what's a naked carb? Well, it's a carbohydrate consumed by itself, right? You got to put some clothing on your carbs. So if you're eating a carb like bread, corn, I mean, she just goes through a list here. Cereal, crackers, fruit, granola, oats, ice cream, anything sweet, you want to dress it up with protein, fat, and fiber. So anything, she gives another list: avocado, beans, butter, cheese, cream, eggs, fish, yogurt, nuts, seeds, nut butter is great. Having done that versus not done that is going to make a big difference, because you're going to see a much smaller glucose spike. So there you see the example of someone who consumed a piece of bread. Now the person below who ate the bread with the baba ganoush, which is made of eggplant and chickpeas. So that's a lot of fiber and protein. Big difference in the blood sugar spike, okay? Now, if you're at a restaurant and they offer this, this is wonderful. Unfortunately, most of the time, right, they're just offering the bread. So we will tackle that area in a minute. Here's another example of a naked carb. So you would think, hey, why am I adding more calories to my pear? Why am I? Well, look at the difference in blood sugars. And even though the pear and the nut butter may be more calorically, it's irrelevant at the end of the day, because that pear by itself, it's going to raise your blood sugars and you're likely going to be hungrier an hour later. So get that good fat and protein in there, and you'll see you won't be hungry for hours. So that's the idea. Keep yourself satiated. Less focus on calories, more focus on the type of food you're eating and how they impact your hormones, your glucose and your blood sugar. I'm sorry, your insulin and your blood sugar. Okay. Big difference there. Okay, once again, we're talking about flattening that curve. Another example of a naked carb. Carbs, I should say, for this example. So how to change someone's toast and life today? Simply by swapping out jam for unsweetened almond butter. Like that person flattened their curve down below, right? You've got almond butter, which once again probably kept you feeling somewhat satiated for hours, versus toast with jam, which is really considered like a concentrated source of sugar, because when you eat jam, it starts out as this much, then it's boiled down to this much, but you're getting the sugar content of this much. So that really makes a difference. No, it doesn't mean you can never have toast with jam again. We're just saying this is an example, how to put clothing on your carb. Okay, here's another similar but slightly different example. So here's someone who had a piece of cake. Now, Jesse really talks about avoiding eating sweets on an empty stomach because you're going to have a huge spike, and she's right. So at least if you're going to do it, enjoy yourself, have a piece of cake, think about how you're going to do it. Maybe have some yogurt with it. Maybe have some kind of protein with it, maybe some nuts. But look at the difference again, okay? These are really simple hacks that really make a big difference. Now we're going to talk about ordered eating. Okay, sorry, I'm just making sure I don't miss any of my notes here. So ordered eating is a really another fascinating hack. And I'd heard about this, and I really, for the longest time, I just heard about it. But then I started to do my homework and my research and found out that this is really a great hack. And you can't apply it with every meal, but you can certainly try. This is definitely going to work with dinner. So you're going to start with your vegetable, like she talks about your veggie starter. We will dive into vinegar in a minute. But then you're going to have your protein, and then you're going to have your complex carb, right? Your fruit, your starchy vegetable, or whole grain. Let's look at this example. So she likes to refer to this as the restaurant conspiracy, right? They serve you bread, and then a few minutes later, you have your meal. Well, look at that blood sugar spike, right? Up and down. Okay. But if we switch up the order and have our vegetables and our protein first, then our bread, holy smokes, look at that. That's amazing. You have almost a flat line there, flattening the curve again. So when you go out to eat, you'll rethink. And maybe if you have the bread last, you might not be as hungry for it. So you might not eat it. Another really great tip. Okay, another example of ordered eating. So we've got veggies first down below, with then the tofu, then the rice. Up above, you can see the spike when you have the rice and the tofu first. I'm sorry, the rice first. And of course, you can always swap that out for a brown rice, right? Depending on your health goals, weight loss in particular. And like I said, not possible to do this at every meal, but this is the perfect example of when you can. Moving on. So, can vinegar really help with your glucose spike? Can it really reduce that spike? Well, let's explore this a little bit. What are the benefits of vinegar? Vinegar has been around since the 18th century as a health ingredient. It was prescribed as a tea, actually, for, I believe it was teens, but with diabetes. And studies show that just 1 tablespoon of vinegar can reduce the glucose spike by up to 30%. That's significant. So what is it in vinegar that's making this, happen? How is this possible? Well, there is an ingredient or a component, chemical component of vinegar called acetic acid, and it slows down the rate at which our bodies break down starches and sugars into glucose. So ultimately, once again, it's taking longer for that glucose to hit your bloodstream, leading to a smaller spike. How to use vinegar to avoid blood sugar spikes? Well, I'm going to start at the top here. You want to think about incorporating it into all of your recipes. Any kind of vinegar. Drink 1 tablespoon diluted in water, 10 minutes before a meal. And remember, you should dilute it in water if you're drinking it. And I also suggest using a straw. This is all to protect your teeth. Add vinegar to vegetables at the start of your meal. So if you're having a salad or green beans, listen, I use any vinegar, white wine, rice wine vinegar. I would avoid a glaze. That's something to avoid. That's going to be concentrated sugar. Apple cider vinegar and white wine seem to be most popular. And I would avoid the apple cider vinegar gummies because I have seen test results and they don't really help because there's sugar in the gummy. So we want to avoid that. But this is a way to utilize apple cider vinegar, or sorry, any vinegar. Now, let's look at this hack using vinegar and ordered eating. So this is a combo hack. So here you have still cut oats, right? Somebody ate oats by themselves. So you see the spike, then it comes down. Whew, okay. Not really good. But here's someone who had some apple cider vinegar. Maybe they diluted it with water, hopefully, and with a straw first. Then they had their eggs and then their starch, their oatmeal. So big difference, huge difference. So these hacks can take you a long way. Okay, let's give you another example of another hack, vinegar and veggies first. So I don't know if any of you have had ceviche or heard of it. Ceviche is fish that's cooked in or marinated in vinegar. It kind of cooks the fish with vegetables. So here's an example of someone who had mango, then rice, then ceviche, and you see the big spike. And what happens when you switch it up? Well, you guys know now, you're pros. Blood sugar stayed level, flatten the curve, and you're probably going to feel much different down the road that day instead of being hungry so quickly. Because that when you have that spike and it comes down, you just don't feel so great. Okay, now let's give you another example. Now, this is kind of fun. Once again, I feel strongly that not everybody should live in a box. You will be having your indulgences from time to time. If you're going to do it, incorporate the hacks, right? So here, this person had their hamburger and french fries. We see the big spike to be expected. But here's someone who had a salad with vinegar first. But then they had their cheeseburger, which is protein, with the white bread, right? But then the fries. So yes, there was still an elevation, but it wasn't as bad. And you see it came down faster. And that's really critical too. So let's move on to what's next here. Whoops. Okay. Now we're going to talk about movement because movement is also really amazingly impactful in terms of reducing that blood sugar spike. So when you move your muscles, when your muscles contract, they need more energy. When you need more energy, it means they need more glucose, right? So that need for more glucose means when you're moving your muscles more, your muscles are going to say, hey, let's get some glucose. They go right into your bloodstream and they pull out that glucose. So blood sugars come down. So movement is going to lower your blood sugars. I'm sure many of you, and I haven't even talked about this yet, but have a continuous glucose monitor or a glucometer, and you see how your numbers come down after you walk or move, right? So this is really important. You can implement this into your lifestyle. So here's someone who had a donut. Okay. I mean, the spike was off the chart because maybe it was on an empty stomach, but someone who had a donut and then vacuumed for 15 minutes. Look at that. Now, you can see the drop though afterwards. So this is why if you're going to have a treat like this, you want to pair it with some kind of protein because you avoid that drop, that big, we call that hypoglycemia after the donut. But you can incorporate the movement and then maybe get a protein in there. Another example, someone who had a piece of cake, big spike, and someone who hiked, and their blood sugar actually remains stable. So everyone is a little different. Some of these examples will vary. One of the things that Jesse does talk about is that not everybody does react the same way to all foods. So it's important to note that. So what happens to your friend who's checking their blood sugars and yours may be a little different, and there could be other reasons. But just note that movement is going to lower you, and that is going to be a good thing as long as you're careful about how you do it. Okay, one more. So just a 10-minute walk after a poke bowl. So poke bowls are going to cause a spike for anyone. Poke bowls, acai bowls. I see this happen all the time. So going for a walk after your poke bowl because of that white rice, that high concentration of refined carbs is going to cause the spike. So going for that walk is going to keep you more stable. Okay, now another fun hack, probably our last one. Avoid drinking too much during a meal? Really? Well, this was interesting, and I questioned this, but I started to research it. So what's really happening is when you drink, and she uses water as an example, which I thought was smart because she could have had fruit juice and then we would have automatically seen a spike, but she uses water, which is neutral. The water speeds up gastric emptying. So that causes glucose to be absorbed faster. So have the water after the meal. I'm sure you gotta have a sip or two during the meal, but you don't want to drink like a big tall glass of water or anything during a meal. So the donut and the water together definitely cause a bit of an elevation there. So big difference. So something for you to note. All right, now, and also, um, blood sugars came down faster to the baseline if you look at that as well. Okay, now, oh, sorry, that wasn't my last hack. So let's talk about sleep. Okay, now, a bad night's sleep can really impact a lot of things. It's going to cause the hormones that keep you feeling full to be dysregulated. So the food you eat the next day may cause a bigger spike than you were even aware it could do. So you can see here someone who had just a cup of coffee with whole milk, blood sugars elevated. Um, the person who had a good night's sleep, there was no difference. So I know for me personally, if I get a bad night's sleep, I know I'm having cravings and I'm hungry the next day, like uncontrollably. That's because my blood sugars are, you know, are going up and down. And this is what we want to avoid. You want to keep that curve flat. So sleep is important. And while we're not going to talk about sleep hygiene today, it's something for a lot of people to consider, especially if you ate a meal and you are checking your numbers and you're saying, why would my numbers be off all the time? This is something to think about. So here we go again. Someone who had a papaya, a piece of fruit after a poor night's sleep. Someone who had papaya after a good night's sleep. So big difference. And of course, you would pair it with a protein, right? So it's not a naked carb. All right. You guys are good. All right, so we kind of covered all the hacks. She does have more. I do encourage you to go to her website. Also, she's on the internet. She's on Facebook. She's on Instagram. She has books. This is one of her cookbooks. I love her cookbook. Listen, I'm not getting paid by her. I just use her hacks with my patients and myself and my family and everyone around me because I think it's so critical and so easy to implement these hacks, especially if you're on vacation or if you're, around the holidays. These are great hacks to use, no matter who you are and what you're doing in your stage of life. So let me make sure I didn't miss anything. I think that's really it. I'm just going to mention that to schedule with me, you can call, that's my direct line. I'm located in Ridgewood with the Center for Diabetes Management. I do see all patients, though. I don't just see patients with diabetes or metabolic disorders. So you will need to contact your insurance to find out if you're covered. I can tell you that traditional Medicare will only cover nutrition counseling if you have a diagnosis of type 2 diabetes or end-stage kidney disease. If you have a supplemental medical plan, you will have to call them to find out if they will cover. Okay? Thank you so much. I hope you guys had a good time and learned something. And Danielle, I guess I'm ready for some Q&A.
Fantastic. That was so interesting. Okay, so we have a couple questions.
Okay, let me see if I
Um,
can. I'm gonna stop my share and see if oh, great. I don't know what I did throughout the whole presentation. I had let's see. Let me go into the Q&A. Okay. All right. No sugar almond milk. Should adding cow milk to coffee be avoided for diabetics? So that's a great question. The idea of, I think the example that was provided was more about you can buy almond milk that's sweetened. So I think that's a concern. People are buying a lot of these non-dairy milks that are sweetened. So I don't think that outside of diabetes, I wouldn't tell someone to drink almond milk versus unsweetened almond milk over cow milk if that's what they drink. You do want to be careful because believe it or not, skim milk is higher in carbohydrates. So if you're going to have milk in your coffee, maybe just a tablespoon of regular cow milk. And if cholesterol or dairy intolerance is an issue, that's where the almond milk may be a better choice. Okay. Vinegar can harm the teeth. Is this still recommended? Great point. During the presentation, I did mention that you should dilute the vinegar with 8 ounces of water and drink it with a straw so that you protect your teeth. I mean, there's other ways to do it. You can certainly put vinegar on your vegetables directly or even your protein. And balsamic vinegar, somebody asked, is balsamic vinegar okay? Yes, it is. In fact, that seems to be a common option. If you want to try that as well with your veggies, that's perfectly fine. What is non-dairy cheese? Non-dairy cheese is a cheese made from anything but a cow. So, so dairy comes from cow, and believe it or not, most people think eggs are dairy, but they're in the dairy section. But eggs don't come from a cow, but they're considered dairy. But but coming back to cheese, you can have cheese that's made from nuts. I've seen almond cheese. I've seen cheese made from let's see, soy. I've seen cheese made from almond milk. I think almond's a big one. Cashew. Um, a lot of nuts. I think the almonds and the cashew are the big ones that are out there. Even like you can find cheese made from chickpeas. It's amazing. You can make cheese from anything. So and it can be another source of protein. If there's a dairy allergy, that may also be something to think about. So let's see. Oh, here we got some more. Okay. What about all the products you see on social media and that claim to lower blood sugars? Are any of them worthy? That's a pretty great question. I'd have to know specifically what we're talking about. There are a lot of products out there that are claiming to impact that GLP-1 hormone, right? There's the weight loss medications that we've all heard about, which are perfectly fine for many people. Um, and there are a lot of products out there claiming to also lower the GLP, I'm sorry, impact that GLP-1 hormone to help lower blood sugars. I do think there are quite a few out there that are great, and I'm sure that there are many out there that are not, that could be, false marketing, not true to their claims. So really, it's a matter of looking at them one-on-one, and that's where we're working with someone like me could help guide you. Let's see. What is the